Okay, we're going to get started, and our first speaker is actually underwritten by Atlantia. It's truly my pleasure to introduce, excuse me, Ted Dinan, and he's going to talk about psychobiotics, a microbiome-focused therapy for depression and anxiety. Welcome, Ted. It's great to be with you, and we'll let you do your screen share and kick us off for this morning.
Great. Thank you very much for that introduction. You can see my screen okay, can you?
You are all good to go.
Perfect, perfect. Well, listen, it's a pleasure to join you today. I am the medical director with Atlantia, and we obviously do a wide range of studies across a wide variety of areas. But given the fact that I'm a medical doctor who specialized in psychiatry, I'm particularly interested in those studies that focus on, I suppose, cognition and mental health and the relationship with the gut microbiota. And I've done most of my research over the years in APC Microbiome Ireland. Now, 20 years ago, if anyone said that you could treat perhaps depression or anxiety or other central nervous system conditions by targeting the microbiota, one would have been laughed at. There was never a possibility at that stage. And it really is, I suppose, within the last 15 to 16 years that the idea that targeting the microbiota might have a mental health benefit has emerged and is generally gaining greater acceptance. So what I want to try to do today in the time allotted to me is convince you that targeting the gut microbiota is a realistic strategy for treating mental health disorders such as depression or anxiety. Now, a few years ago, my colleagues and I introduced a concept into the literature that is undoubtedly taken off. A lot of people use it now, and it's the term psychobiotics. Now, what is a psychobiotic? Well, when we introduced the term initially, we defined it as bacteria, which when ingested in adequate amounts had a positive mental health benefit. Now, we've expanded that definition recently by incorporating molecules which, when utilized by bacteria, have a positive mental health benefit. So it can either be, I suppose, bacteria that would traditionally fall under the rubric of a probiotic, or molecules such as prebiotic fibers that can promote the growth of good bacteria. And in some circumstances, those molecules undoubtedly can have a mental health benefit. On the left-hand side of the screen there, you see our book, which John Crine and I and Scott Anderson have put together, the Psychobiotics Revolution, where we set out our stall in relation to psychobiotics. But the whole concept of a psychobiotic is that there is a gut-brain axis, that there's this bidirectional communication system between the gut and the brain, and that by modulating the microbes, we can change brain activity and behavior. Now, undoubtedly, stress is the great problem of the 21st century. And on the right-hand side of your screen there, you see Hans Selye, who was the first person really to demonstrate and to show clearly that stress could cause a variety of conditions, both physical and also mental health problems. And we now know that stress, when it's present in significant amounts and poorly controlled, does increase the risk of depression and anxiety disorders like panic disorder, generalized anxiety disorder, post-traumatic stress disorder, and of course the gastrointestinal disorder, irritable bowel syndrome. So stress is a problem. We know that it's become a bigger problem as a result of COVID. I mean, all the epidemiological studies conducted on both sides of the Atlantic in recent months would suggest that whilst about 10% of the population describe stress in their lives before the COVID epidemic, up to 40% of people now report themselves as stressed. Has that had mental health consequences? Well, it has. I mean, there's a paper published in one of the American journals just 2 or 3 weeks ago showing that the rates of depression seem to have increased 3 to 4-fold since the onset of this pandemic. So stress is the main risk factor for a variety of psychiatric disorders. And if stress levels increase, unquestionably, the risk of these mental health conditions increases dramatically. Now, when we look at the gut microbiota, we have about 1.5 kilos of bacteria in the average general adult gut microbiota. And there's an enormous genetic load in that gut microbiota. You know, I make the point always, because I think it really is very true, that if you were to take all of the DNA in the gut microbiota, the product of which we require, we wouldn't be able to fit all of that DNA into our cells. So it really is very essential that we have co-evolved. There's never been a time when humans have been sterile. We have always had bacteria. We've always fed those bacteria. And in turn, those bacteria have always produced molecules that our brains and other organs require. Now, there are over 1,000 different species of bacteria and in the intestine. And the bulk of the bacteria, of course, and viruses as well, are in the large intestine, although there are bacteria and viruses even up to the oral cavity, but the bulk are in the large intestine. Now, the biggest determinant of our gut microbiota as adults is what we eat and what we do with our lives. If we exercise a lot, we're going to have a different microbiota than if we were sedentary. If we have a good diet, and we'll talk about what a healthy diet is in a minute, we're going to have a good microbiota, whereas an unhealthy diet, the corollary is true, will result in an unhealthy microbiota. So how do gut microbes communicate with the brain? Well, the brain can communicate with the gut and presumably the microbes as a result, but those microbes can communicate with the brain. A few years ago, John Cryan and I, in one of our studies, showed that the vagus nerve, which is that long meandering nerve connecting the brain and the gut, that it did transmit signals from microbes to brain. And that if the gut or the vagus nerve was severed, that those microbes could not communicate with the brain. So the vagus nerve is a very important route of communication. Another very important route of communication, and we'll talk about it maybe in a little more detail later, is the production of short chain fatty acids, the production of butyrate, propionate, acetate. These get into the bloodstream. They're the products of microbial activity, and they undoubtedly can travel to organs around the body and have an influence there. Now, they influence through a variety of mechanisms. They can be epigenetic regulators. In other words, they can influence the way genes act or behave. They can also act through receptors, specific receptors, which we call GPCRs, so G protein coupled receptors. So they have diverse range of actions, which are undoubtedly important, I think, from a neurological and a mental health perspective. Another important route of communication is the fact that certain microbes can produce tryptophan. Now, it used to be thought that all tryptophan, which is the building block of serotonin, that it all came from our diet. Well, we now know that, in fact, bifidobacteria can synthesize tryptophan. And interestingly, the human brain, obviously, serotonin is a very important neurotransmitter in the human brain because it regulates a variety of functions, including mood, sleep, and appetite. But in order to produce enough serotonin, we need enough tryptophan. And the human brain does not store tryptophan in any great quantity. So we need a constant supply. And as I say, there is a dietary supply, but unquestionably gut microbes also provide some of this tryptophan, which is entering the bloodstream, and some of it makes its way to the brain, where it is converted into serotonin. Now, they're just some of the ways. There are probably other parallel routes of communication between gut microbes and brain, but I think they are some of the more important connections. Now, clearly, when one looks at the DNA and one says, one right now is not capable in your average adult of changing the genes in your cells. But it is possible to change the genes in one's gut microbiota. Now, the gut microbiota has often been referred to as a pseudo-organ. It's an organ within an organ. It behaves like an organ, a metabolically active organ, like, let's say, the liver. And as I said previously, it has a massive amount of DNA. So we can change the genes in the microbiota. And I think that is a very important concept from a health perspective, that in fact, the genetic makeup of the gut microbiota can be altered without resorting to any radical CRISPR or any other technologies by simply changing our diet or our behavior patterns. So how can we change our gut microbiotas? Well, undoubtedly, ingesting probiotic bacteria, or specifically psychobiotic bacteria, if you're interested in mental health, is one way. Ingesting prebiotic fibers. Now, we'll talk about where they come from in just a moment, but prebiotic fibers are metabolized by certain microbes and promote the growth of those microbes. I mean, clearly, if a microbe is dependent upon a certain nutritional component and one doesn't ingest that nutritional component, then the microbes are going to die away. Whereas if one feeds the microbes selectively, you will promote the growth of those particular bacteria. Now, diet is obviously the easiest way of altering one's gut microbiota. And a varied or rich diet will result for most people in a fairly rich gut microbiota. The most radical way of altering the gut microbiota is via a fecal microbiota transplant. Now, FMT is clearly a radical way of altering the gut microbiota. It's really clinically the only indication for it at the moment is for the management of C. difficile infection. But there are other emerging conditions like Parkinson's disease. There's some evidence preliminary that an FMT might be beneficial in treating a condition like Parkinson's disease. Interestingly, a wide variety of drugs, 75 to 80% of all the drugs prescribed by doctors impact the gut microbiota, and most of them in a negative way. And of course, because elderly people are often on many different medications, these medications can impact the gut microbiota and thus adversely affect the overall well-being of the elderly individual. Now, we showed a few years ago, this is a study we published. We looked at patients attending my clinic at Cork University Hospital, and we compared the microbiota of those patients with the microbiota of healthy subjects. And if you look at the right-hand side of your screen, you see a principal component analysis, and you can see that the gut microbiota of the patients with depression is very different that of the subjects, the healthy subjects. So there's a lack of richness, microbial richness in the microbiota of depressants. And to our surprise, we find that when we transplant the microbiota from a depressed patient into a rat, that rat changes its behavior, its immunology, and its chemistry. Whereas if a rat, and one doesn't have to do anything horrible to a rat to transplant a microbiota, but if one transplants the microbiota of a healthy subject, the rat just behaves normally and there's no change in immunology or chemistry or behavior. So the microbiota of a depressed patient does have an impact if it's transplanted, which of course raises the question, and I always make the point that if one is doing a transplant of, let's say, an FMT into a patient who has C. difficile, which is the most common reason for doing a transplant, I think it is so important to make sure that the donor hasn't a history of psychiatric illness, particularly depression. Now, Let's look at a few putative psychobiotics. Here's a study we conducted a few years ago with a biflongum strain. And what we did was, it was a placebo-controlled study, and we were interested in looking at stress responses and cognitive function. Now, what we essentially found, cortisol is the main stress hormone in humans. I think most people will be aware of that. Now, when the subjects were treated with the biflongum, their cortisol levels in the morning dropped. When they were treated with placebo, there was no change in their cortisol levels. The subjects didn't know whether they were taking the biflongum or placebo, but when they took the biflongum, they reported themselves as feeling less stressed. So their cortisol levels were lower, they felt less stressed. And interestingly enough, there was a slight improvement in cognitive function, which we demonstrated in a variety of ways as well. Interesting also, and this, there's no need to go into detail in this, but the electrophysiology of the brain altered when the subjects were taking the biflongum, which I find intriguing. It was the first time, I think, that was demonstrated by any particular group. Now, this is another study with the biflongum where we took students in the university over 2 semesters, and in one semester we treated them with biflongum, and in another semester before their exams we treated them with placebo. So we have them over 2 exam periods, 2 semesters, 1 semester biflongum treatment, 1 semester placebo. What we found was that the sleep duration was enhanced with the biflongum treatment. Now, there are 1 or 2 other strains of bacteria where this has been demonstrated as well. So certain psychobiotic bacteria do seem to be capable of altering or improving sleep quality. Now, I think it's very important to point out that the overwhelming majority of bacteria that are referred to as probiotic have no mental health benefit whatsoever. We've looked at dozens of bacteria over the years, and most of them do nothing. And some work beautifully in rats or mice. If you're a rat or a mouse, they're absolutely wonderful, but those findings do not translate into humans. So this was one study where we used a Lactobacillus rhamnosus. It was the JB1 strain. We had wonderful preclinical data, but in fact, when we looked at the effects of it in a placebo-controlled study in humans, we found no effect whatsoever on any parameter: immunology, endocrinology, stress responses, you name it, we found no changes. So I don't want anyone to leave with the impression that all probiotic bacteria have mental health benefits. They do not. It is a small percentage, and the question is, how do you find those bacteria? And I suppose it's like trying to find the needle in the haystack, as I've said in a paper I had in the British Journal of Pharmacology there 2 or 3 years ago. And of course, there's also a perception that probiotics have to be alive in order to produce an effect. And this was a study that Colin Hill, a colleague and friend of mine, and I published 2 or 3 years ago, where we found that a heat-killed lactobacillus actually had behavioral effects, which is interesting. So, one would assume then that if that is the case, that it isn't the fact that the bacteria is alive, because clearly these are the heat-killed, but that it's some molecule on the surface that's stimulating an immune response and thus bringing about a behavioral effect. Now, depression is a nasty disorder. I've spent my career treating people with clinical depression. Depression during pregnancy is particularly nasty, and about 20% of women become depressed during pregnancy or in the postpartum period. And I think that this is an interesting study. It's a study of a Lactobacillus rhamnosus, a different strain to the one I described previously. It's HN001, and there were a total of 423 women who in the 2nd trimester of pregnancy were randomly allocated to either go on the Lactobacillus rhamnosus or placebo. And they took it for the 2nd and 3rd trimester of pregnancy and for up to 12 weeks postpartum. Now, their depressive and anxiety symptoms were monitored using the Edinburgh questionnaire, which is one of the most widely used international questionnaires for looking at mental health or depression and anxiety symptoms during pregnancy. And the bottom line essentially was that those women who were taking the probiotic, the lactobacillus rhamnosus, as opposed to those who were taking the placebo, overall had far lower depression and anxiety symptoms postpartum. Now, I think that's very important because clearly women who are pregnant do not want to take antidepressants. If at all possible, I've had women take antidepressants where there was no option. But if there was a natural alternative, clearly, I think many women would choose that natural alternative. And I think that for milder forms of depression, I think that psychobiotics do have potential in this area. This is another study. It's just out as a preprint in Brain Behavior and Immunity. It's a study from Dinan et al. It literally only came out within the last week, and I thought it was interesting. It's a study of 45 depressed patients, all significantly depressed with major depressive illness, randomly assigned to 4 weeks of treatment with 10 to the 10 CFU per day of Bifidobacterium breve or placebo. So you've half on Bifidobacterium breve and half on placebo. And what they essentially found, without going into too much detail, is that depressive symptoms were dramatically decreased on the Bifidobacterium breve relative to that seen on placebo. There was also alterations in serotonin turnover, which I think serotonin and mood are intimately linked. So maybe that is the mechanism. Now, it's a small study. It's not a definitive study with just 45 subjects, but I think it does tend to support the view that certain psychobiotic bacteria do impact depressive symptoms in a positive way. Now, this was a meta-analysis. Meta-analysis is obviously where you combine a whole load of small studies and make big conclusions. And I'm not the greatest fan of meta-analysis, I must say, as a technique, but it does have a role to play, I suppose, if one uses it judiciously. And here is a meta-analysis that was published a few years, well, just two years ago. And it basically came to the conclusion that, yes, probiotics or psychobiotics have a role to play in managing depressive symptoms, and that multiple strains, that's where you combine strains, seem to have a more effective outcome than a single strain. So, there are obviously fermented foods in naturally occurring, there are probiotic bacteria in naturally occurring foods. I mean, yogurt, kefir, kombucha, and so forth. I think all of these certainly have a role to play in maintaining gut health. And I think, whilst there's probably a paucity of data, they probably have a role to play in relation to maintaining good mental health as well. And these are some studies that have been published by our group and by others, showing that the ingestion of probiotic bacteria in foods like kefir can influence brain function. So yes, we need studies in patients with mental health difficulties, but overall, the emerging evidence would suggest that fermented foods do not only have a positive benefit from a gut perspective, but may have a positive mental health benefit as well. Now, prebiotics are obviously molecules that are utilized by bacteria, promote the growth of good bacteria, and promote the production of short-chain fatty acids as well. And these are some foods where there's a high level of inulin, which is a prebiotic fiber that has been very extensively studied. Now, this is a preclinical study, and I'm not going to go into great detail, but when the pharmaceutical industry are looking for molecules that give a signal of antidepressant activity, the two studies they use are the tail suspension test and the forced swim test. And as you can see here, when you look at FOS and GOS, which are two widely studied prebiotics, you see that these two prebiotics, when combined, have a positive antidepressant effect on both the tail suspension test and the forced swim test. So it raises the possibility that these two fibers in adequate amounts do have antidepressant activity. Now, this is a study from colleagues of ours in Oxford, and it was a study in healthy subjects using a modified form of GOS called BGOS. Now, the awakening cortisol response is probably the best measure of stress. You can measure it in saliva. And what you see here in the middle panel is that BGOS significantly decreased cortisol, salivary cortisol levels in healthy subjects, which suggests that it has anti-stress activity, this prebiotic fiber. Now, when we look at prebiotics, we think of, traditional things like inulin, FOS, and GOS, but there are substances out there that behave as prebiotics. Curcumin is one of them. And it does bring about a greater diversity in the gut microbiota. And there are suggestions. Now, look, people make claims of antidepressant and anxiolytic effects. I think that we need more data, but it certainly does seem to have a prebiotic type effect. Likewise, polyunsaturated fatty acids like EPA and DHA, which come largely from fish. And I think it was our group were the first to show that EPA, which is one of the key polyunsaturated fatty acids from fish, that it has the capacity to increase levels of bifidobacteria in the intestine. So it promotes the growth of good bacteria. So I think you can describe polyunsaturated fatty acids as having many different actions, including obviously an action directly in the brain, because the brain is a fatty organ and we need polyunsaturated fatty acids. But EPA does promote the growth of good bacteria in the intestine. Now, this was a paper which is essentially a consensus document from a European-funded project called the MyNew Gut. And really what it does is it suggests that for good mental health, that one should have a diverse range of foods, which should include fermented foods, should include plenty of fruit and vegetables, nuts, fish, that red meat should be kept to a minimum. So a diverse range of foods, essentially a modified or a not so modified version of the Mediterranean diet, was the best for promoting good gut health and for promoting good mental health. So we recommended this particular diet for anyone who was either suffering from depression or was vulnerable to depressive episodes. So, in summary, ladies and gentlemen, I think the brain-gut microbiota axis does play a very important role in regulating our stress responses. And this is only something that really has been recognized in recent years. Undoubtedly, diet acting via the gut microbiota may play a pivotal role in managing stress-related disorders such as depression. And I think anyone who suffers from depression or anxiety should look at their diet. And as a psychiatrist, I must say, my colleagues up until now have been very reluctant to give dietary advice, which I think is a pity, because I think dietary advice given in association with psychological interventions and with medication can really improve the lot of patients suffering from anxiety or depression. And I think psychobiotics and prebiotics have the potential, a significant potential in managing stress-related disorders. So I think overall, the healthy diet is essential for promoting a good mental health. Thank you very much for your attention.
Thanks very much, Ted. And I've got a couple questions that have accumulated, and we'll bring those forward. Some from the audience and some from our panel behind the scenes. And we'll encourage others that wish to submit questions to please do so. First question is sort of the elephant in the room. Let's talk about psychobiotics. With the promulgation of the microbiome as an interest area, you've got prebiotics, postbiotics, symbiotics, all the biotics and psychobiotics. Is psychobiotics going to resonate And is it going to be a medical term? Is it going to be a treatment term? Is it going to be a consumer term? In the future, where do you see that term landing?
Right. Well, I would, as a psychiatrist, I suppose, my primary interest is in people with mental health problems. So I would like to see psychobiotics evolve for the management of milder forms of depression and anxiety. You know, a lot of patients, when they go to GPs, are told, you're suffering from depression, I want to put you on an antidepressant. There is a reluctance on both sides of the Atlantic, a reluctance to take antidepressants. And I see psychobiotics as an alternative, a natural alternative for treating depression, milder forms. I don't believe that we're talking about extreme forms of depression, but milder forms of depression and anxiety.
So, but from a regulatory and product development, and then the scope of the clinical base here, you're talking of a treatment, therapeutic type of angle that could be adjunct with some dietary advice, but that's really the direction. So practitioner target, professional target market.
Indeed. Now that could be, it could be at the premium supplement end of the market. It could be as a medical food, or it could even be as an RX treatment prescribed by a physician.
Okay, we've got a question that has come in, and it actually was raised yesterday. FMT, fecal transplants. Obviously, there are some excellent science, but the practicality of that moving into therapeutics, there's some limitations and maybe some constraints and maybe some cultural issues. Do you see that being replaced through probiotic therapies, prebiotics, symbiotics, postbiotics? Do you see that movement occurring?
I do. I think I think in about, within the next decade, we're going to see polybiotics, which are clusters of bacteria. There may be 8 or 10 bacteria involved, which will, I think, replace FMT, which for all sorts of cultural reasons, as you allude to, isn't an acceptable treatment for some people, although its efficacy is phenomenal when you look at C. difficile, a 90% improvement. But I do think that we will get to a point where we will understand more the key microbes that are essential within the FMT. And of course, that might not, when I say key microbes, those key microbes may not only be bacteria, but they may be phage as well. We need to know more about which key phage are essential in the efficacy of FMT.
Interesting. One of the things that that was very, very strongly supported in your presentation was the strain specificity, not just going genus and species, but being very, very strain specific. Then you made the comment about the meta-analyses and combining studies, and then you've got the outcome of multi-strain, but yet most of the clinical research is on single strain. How do you reconcile that in the sort of how do you advance sort of this understanding of the strain specificity against meta-analyses? So maybe talk a little bit about that reconciliation.
Indeed. I have a problem with some studies where they put 3 or 4 strains together, and it's not always clear that these strains aren't even knocking each other out. I mean, some studies, they haven't even demonstrated that one bacteria isn't actually knocking another bacteria out in terms of, as it passes through the gut. Of course, one of the big problems as well in this field is a complete lack of dose response findings. I mean, nobody would develop a small molecule until they did a dose response study demonstrating efficacy at a certain dose. But in fact, one of the big problems in this area is that people are inclined to go in at 10 to the 9 CFU or 10 to the 10 CFU. Now, where did those figures come from? They seem to have been plucked out of thin air. I mean, they're not actually, based on solid science at all. I mean, if something works at 10 to the 10, I think we should go down and see, well, when does it stop working? Does it stop working at 10 to the 6? Does it stop working at 10? You know, but we lack those sorts of studies. And I suppose, you know, I would hope that as we become more rigorous, and I think that this area really requires rigorous science, we really require high caliber clinical trials. And one of the reasons I suppose we haven't got them is that in anxiety and in depression, you need maybe 180, 200 patients to demonstrate that a good probiotic effect is there above and beyond what you see with placebo. And there are very few food companies or smaller companies prepared to invest that amount of money. And up until now, Big Pharma hasn't been seen too much in the space. I suppose some companies are dipping their toes, but I would like to see really well conducted studies. And in some ways, all meta-analysis is an attempt to produce big data from often poor quality, unreliable small studies.
Mm-hmm. Therein lies the danger. We've got a couple more questions that have been posted. Ted, we'll come back to you and maybe we can get some written answers, or maybe you and I will do a follow-up video on this, because I think there's a lot more to unpack as we consider what is the future in this exciting area. But I do want to thank you for the presentation, the engagement, and we'll move on. But really a great presentation.
My pleasure. Thank you.